Order Profile Overview and Navigation, Module 2. The Order Profile screen is considered the source of truth, displaying all electronic orders placed in Cerner. Click on Orders in your main menu to open the screen. Rather than scrolling through all of the orders one by one, you can use filters and quick navigation features to review orders more efficiently. There are two main parts to the Order Profile screen: the View Navigator on the left and the Order Components display on the right. The View Navigator is divided up into sections: Orders for Signature, Plans, and Orders. Whatever section is highlighted in the View Navigator on the left will display in the Orders component on the right. Clinical categories are listed under Orders in the View Navigator and are check-marked and bolded if there are orders in that category. It is important to leave clinical categories checked so that orders in that category are displayed. Clicking on a specific clinical category will move that category of orders to the top of the Orders display screen for easy viewing. You can remove the navigator from your view by clicking on the arrow at the top, thus expanding the Orders component display. Now let's take a closer look at this section of the screen. Notice the display filter is currently set to display all orders, all statuses. This view is helpful in giving you the entire picture of the patient's order profile. If you wish to adjust the filter, select the desired display from the drop-down. Here we have adjusted the filter to display only active orders. Next to the display filter is an ellipsis. Click on the ellipsis to open the Advanced Filter screen, where you can select more specific order statuses to display. For purposes of this training video, we will reset the filter back to all orders, all statuses. It should be noted that when a patient has been hospitalized for a prolonged period of time, there may be a considerable number of orders listed in the order profile. When this occurs, Show More Orders will display in blue at the bottom right of the screen. Click on this to access additional orders. As you look down the Order Profile screen, you will notice various icons associated with each order. The hospital icon identifies a hospital order. The eyeglasses appear next to an order that has not yet been reviewed by a nurse. The mortar and pestle icon indicates an order that has not yet been verified by a pharmacist. The hourglass with lock denotes an order that is due to expire. The caduceus symbol represents an order requiring physician co-signature. The black and white pamphlet icon indicates there is reference text associated with that order. To access the reference text, click on that icon. One final icon is the yellow square indicating the order is part of a power plan. Note that hovering over an icon will provide you with the meaning of that icon. We stated earlier that the Order Profile screen is considered the source of truth, displaying all electronic orders entered in Cerner. Important information related to each order can be accessed by right-clicking over the order in the profile and selecting Order Information. The Order History tab gives you information about who entered the original order and when the order was placed. If the order was placed by a nurse, the provider giving the order to the nurse will also be listed. Actions taken on the order, such as modifications along with order status, order details, comments, and co-signature history, are also displayed. Order details include order duration and stop date and time for that order. Here at Shore Medical Center, the following order duration is in place: routine and PRN inpatient medications, 30 days. Narcotics, Schedule 2, 3, 4, and 5 controlled drugs, 7 days. Large volume maintenance IVs and large volume with additive IVs, 72 hours. When orders are entered in a group or power plan, the plan history can be reviewed by right-clicking on the plan name in the View Navigator and selecting Plan Information. As with the Order Information screen, the Plan Information screen provides you with who entered the original plan and when. Dated and timed actions taken on the plan are also included. We will discuss power plans in more detail in our power plan module. There are 3 tabs displayed in the order profile: Orders, Medication List, and Document and Plan. Each tab contains different information related to the order profile. We have discussed the Orders tab in detail, so we will briefly look at the other 2 tabs. The Medication List displays lists of medications based on the display filter setting. Notice the display filter is currently set to display home medications. This view is helpful in giving you the entire picture of the patient's home medications. If you wish to adjust the filter to see a different display, use the drop-down. The third tab is the Document and Plan. This tab contains a list of IPOCs or interdisciplinary plans of care for the patient. The nurse is responsible for the addition and modification of these plans. IPOCs will be covered in detail by your preceptor. Related results can be found at the bottom of the view in the order profile. This function allows the clinician the ability to view results that are directly related to a particular order. For example, if the provider was to order a digoxin level, he or she would click on Related Results to see the most current dig level for the patient. This concludes Module 2.